Mental health remains a top concern within the area of Winnebago County, with requests for emergency mental health services continually coming in. The county's crisis co-response team answers those calls, pairing a mental health professional with officers to best address the situation. 13 WREX's Destin Howard is digging deeper into the progress of that program. Destin.
Derek, the manager of the Crisis Co-Response Team, informed me that since the start of that program 3 years ago, they have made strides in the number of people helped. However, there still remains a lot of work to be done in areas like data collection, the frequent need for follow-up care, and starting a conversation on how to grow their services. In 2023, the Crisis Co-Response Team helped more than 1,900 people. In 2024, they have already helped more than 1,200 people. Looking back on the progress they have made thus far, the program's manager, Mary Todrijo, says they are beginning to start the conversation on how to not only service more people, but provide an even higher quality of care.
We're kind of transitioning out of our pilot type state to kind of really trying to figure out, okay, now what more can we do really to help the community and to build on the program? And so we haven't compared data necessarily to other organizations yet, but that's something that I would like to do.
Less than 4% of calls to the Crisis Co-Response Team results in an arrest, but that is just the start of their work. One of their top priorities is following up with people after the initial reaction.
So they kind of go out in the crisis situation, de-escalate, work with the individual to ensure safety, and come up with a plan moving forward. But that's not where it stops. They, go back out and probably would follow up with the individual, in a week or two. They might follow up the next day if it's a very serious situation where they think that that's, appropriate.
Kevin Thomas has worked as a mental health professional for 16 years. While he agrees with their mission, he thinks co-responders need to be more visible in the community and not just when a crisis happens.
For the most part, a lot of barriers of a lot of the community members are not seeing a lot of the clinicians, the therapists, and the psychologists and things of that nature in their community. So they're really slow to connect with one and to have a relationship where they can start the healing process.
If you find yourself or someone in an emergency crisis mental health situation, you can dial 911 immediately and ask for the Crisis Co-Response Team. Derek.